To fear is
In war, there is no substitute for victory.
Let us never negotiate out of fear.
We stand undivided, forever united, fighting hand in hand for the liberty we've earned, for glory and honor, for our sons and daughters, ever mindful of the lessons we've learned. Let the torch of freedom burn.
Welcome to the intersection of faith and politics. This is WallBuilders Live. Thanks for joining us today. Be sure and visit wallbuilderslive.com and also wallbuilders.com. You found us on a Friday, so it's Good News Friday. Got a little bit of a twist on Good News Friday for you this week. Got a special guest going to join us here in a few minutes after the break. And David, today we're going to devote our good news to the fact that we found some ways to, I think the way our guest later likes to call it, a free market solution within Obamacare, which might sound crazy at first.
Yeah, Obamacare right now is in the news, of course, because it's at the Supreme Court. They've argued the case now. We have to wait for the Supreme Court to tell us whether they're going to strike down Obamacare or not. But that is a distinct possibility. At least observers believe that that's a real possibility. So we'll see. In the event that the court does not strike it down and we're still stuck with it, until Congress does something to repeal or replace or whatever they're going to do, which will not be within the next 2 years. It will have to be after the election, assuming the Republicans can win the election for president and get someone as the presidential candidate who actually wants to try to do something to change this, assuming that you keep the House and the Senate and that they still want to do that. There's a lot of ifs between now and 2 years from now. But if the court does strike it down, then you still got at least another year that this is going to be operating, and there's a ton of people being affected by it right now. So one of the guys that we have dealt with for a number of years, Rick, you and I know Pat Colbeck real well, a senator out of Michigan. He's been for several years at the state legislative conference we do through WallBuilders, Pro-Family Legislators Conference, and he actually is one of the very few people in all of America who read this thing from start to end, the entire Obamacare bill. And at the end of it, he found a loophole that was a massive oversight on whoever wrote the bill that actually allows us to basically dismantle Obamacare from within Obamacare, which is an amazing thing to do. So they've gotten this bill passed now in Michigan, and we thought this would be good news. Have Pat talk about what they've done in Michigan and what this really means for the rest of the country. So this really is good news for a Good News Friday.
Senator Pat Colbeck, he's a good friend of the program. Look forward to having him on. He'll be with us when we return right here on WallBuilders Live.
This is David Barton with another moment from America's history. Our founding fathers, despite their common love for America, did not always agree with each other in politics. Such was the case between John and Samuel Adams. John was the leader of the Federalist Party, and Samuel was the leader of the Anti-Federalist Party. Consequently, political disagreements were not unusual between these two. On October the 4th, 1790, Sam wrote John and told him, "Let ministers and philosophers, statesmen and patriots unite their endeavors to renovate the age by educating their little boys and girls and leading them in the study and practice of the exalted virtues of the Christian system." 2 weeks later, John wrote back and told Samuel that on this issue they both agreed. While these two prominent founding fathers disagreed on much, they both agreed on the importance of educating the next generation in the principles of Christianity.
For more information on God's hand in American history, contact WallBuilders at 1-800-8-REBUILD.
Let the torch of freedom burn.
Welcome back to the intersection of faith and politics. Thanks for staying with us here on WallBuilders Live. Our guest today, our good friend, State Senator Pat Colbeck from the great state of Michigan. Senator, always great to have you, bro.
Oh, it's great to be with you, Rick.
Hey, thanks for coming back on. It still surprises me how many times over the last couple of years we've been able to have you on to talk about good news and victories out of Michigan. You guys have been able to accomplish so much up there, and just super proud of you and what's been done. One area most people in the country don't realize there's even been victories. I mean, conservatives have been obviously concerned and angry over the whole Obamacare situation. But there's been some little victories here and there that you just don't hear much about. You guys are experiencing that in Michigan with an idea that you've talked about on our program before and that you brought to the legislators' conference and that now has been accomplished in Michigan. But put it in the context of the bigger picture with some of the things going before the Supreme Court now, and just kind of catch us up on where we are in the health care fight.
Oh, that's great, Rick. I appreciate the opportunity. Yeah, there's been a lot of good things happening on the health care front. I mean, a lot of Republicans get dinged pretty bad for not providing alternatives to Obamacare, and we think we've got a pretty good alternative. I guess the backdrop of what's going on in the Supreme Court, which kind of tees it up for a discussion of that alternative. Many people are maybe familiar with the King versus Burwell case, and that King versus Burwell case essentially says that the subsidies that are being offered for Obamacare in the law only talk about the subsidies being offered via state-based exchanges. So if you're one of the 36 states that has actually opted for a federal exchange, then the law technically does not allow you to provide subsidies for policies that are available via federal exchange. And the Supreme Court's going to decide whether or not that really is the case, or if they're going to find some way of going off and ruling that there was another intent or something else that convoluted. But the law is actually pretty clear about stating that those subsidies are only available via the state-based exchange. And this is a big deal because if they rule in favor of the plaintiff, which is King in this case, the federal government has to cease and desist on those subsidies that are being offered in that Fed exchange.
So at that point, is that? Yeah, go ahead. Yeah, tell us what that means. I mean, how does that affect states that don't have an exchange?
When you do that, you got to pay market price on these health plans. Now, on the surface, you're sitting there saying, "Oh, well, that's going to make it unaffordable for a lot of people," and that's not a good thing. But there's actually a portion of the bill. I'm actually one of the oddballs that actually read the Affordable Care Act, and it was not pleasure reading.
That was your 2014 all-year reading. No books for Pat Colbeck. He spent all year long reading the Affordable Care Act.
One of the provisions in there that gets you excited about this King versus Burwell is that if your health plan, it's the only health plan that you can find that meets the qualified health plan requirements of the Affordable Care Act, costs greater than 8% of your household income, you are no longer subject to the mandate. And just to put that in perspective, you would have to be earning a household income of $200,000 or more to start getting in the range of a household plan or that would meet all the requirements of Obamacare. So, in effect, for most of the population, you've removed that individual mandate. So
it basically wipes it out then in those states.
Yeah, I like to call it the get out of Obamacare free card.
So what is the time frame for when we would know whether or not that's, which way the court's probably going to go on that?
The decisions are due out in June of 2015. So we shall see. In the meantime, I think the Obama administration says that it has no fix if the Supreme Court rules in favor of the plaintiff. And I would actually like to respectfully disagree with them and suggest that there already is a fix, or at least a portion of a fix, already embedded in the law itself. And it's way at the back of the law. It's in Section 10,104, and it deals with a little-known approach to health care known as a direct primary care service agreement. And it's authorized as an element of a comprehensive qualified health plan via this late-night amendment that the folks who didn't read the bill before they voted on it, they passed it through, and we have essentially what I like to call a free market loophole in the middle of Obamacare.
A free market loophole in the middle of Obamacare. I love it. We got to take a quick break. Pat Colbeck, our guest state senator from Michigan. Stay with us here on WallBuilders Live.
This is David Barton with another moment from America's history. Today, numerous court decisions demonstrate that there's often a conflict between the courts, the law, and religion. Has this conflict always existed? Not according to James Wilson. James Wilson was a signer of both the Declaration of Independence and the Constitution. He was a law professor as well as an original justice on the U.S. Supreme Court. James Wilson saw no conflict between religion and the law. In fact, just the contrary. He declared, "Human law must rest its authority ultimately upon the authority of that law which is divine. Far from being rivals or enemies, religion and law are twin sisters, friends, and mutual assistants. Indeed, these two sciences run into each other." In the views of Founding Father James Wilson, religion and good civil law were inseparable.
For more information on God's hand in American history, contact WallBuilders at 1-800-8REBUILD.
Let the torch of freedom burn.
Welcome back. Thanks for staying with us here on WallBuilders Live. We're with Pat Colbeck, state senator from Michigan. We're talking about Obamacare and the loophole, the free enterprise, the free market loophole in the middle or towards the end of Obamacare. Senator Colbeck, you said you're one of the few guys that actually read the bill. And when you found this, it became much more than just a theoretical discussion. You've actually put this into practice in the state of Michigan.
Yeah, actually, we were pretty blessed recently to have passed a bill to take advantage of this free market loophole in the Affordable Care Act and allow direct primary care services to be part of that qualified health plan. And our legislation that we passed actually prevented our own state insurance regulators from regulating what's known as direct primary care services through the state as far as treating it like an insurance product, and because it's not. And maybe it's probably worth a quick explanation of why I'm so excited about direct primary care.
That's what I was just about to ask you. What is that?
What the heck is that? Well, in the Affordable Care Act, there's been about 159 organizations created between a doctor and a patient, and all under the auspices of lowering our costs and improving quality of care.
And when you say between, you mean literally standing between the doctor and the patient. I mean, those are all these different organizations that are creating that friction, or as Milton Friedman would call it, noise in the marketplace, preventing us from getting to a direct price between those two parties.
Exactly. And by the way, it's those 159 new organizations that are pushing primary care physicians out of the practice of medicine at a record clip right now, too. So what we want to do is actually restore the practice of medicine to that doctor-patient relationship, and direct primary care gets us back to that foundation. And essentially, the key word in the statement and the term direct primary care is the word direct, because under a direct primary care arrangement, you don't have to worry about what those 159 organizations between a physician and a doctor have to say. It is a direct agreement between the doctor and the patient, and it's you set up a retainer agreement, just like a regular contract that you might have with your cell phone provider or with your cable TV provider. The doctor lists the specific services that are provided in exchange for a retainer agreement for a monthly or annual fee around to provide those services. So when you go into the doctor, there's no third-party payer card. There's no insurance card associated with it. It's just a direct relation. You don't have to get Mother May I, Mr. Insurance Company, can I do this? Or go to the government and say, Mother May I, can I get this procedure taken care of? It's just between you and the doctor.
That's how you get to a fair price, right? Because you're cutting all those extra expenses out. I mean, nobody's suggesting that well, actually, I would suggest that you're going to get the price down to where people can actually afford it. If you cut out all these middlemen, maybe somebody can actually afford to go to the doctor for a checkup or for something that they need.
Exactly, and that was the fundamental starting point that I had for what I like to call a patient-centered care solution, which features direct primary care in conjunction with a high-deductible health plan for catastrophic care, all within a tax-exempt account. What they found is that when you add direct primary care to that overall health plan, your costs are about 20% lower, and you actually get better care. They've actually had studies that demonstrate that hospitalization goes down by 50%. And what happens when those big catastrophic costs go down on the order of 50%? well, your premiums for that high deductible health plan for the catastrophic coverage go down as well. So the fundamental premise of the Affordable Care Act is that the way they lower costs is by taking money from one group of people and giving it to another group of people to subsidize their costs. The idea of this patient-centered care solution is to go take a step back and say, how do we lower the cost of health care for everyone? And the centerpiece of that is this direct primary care service model.
So with you guys passing it in Michigan, how does it get implemented?
Yeah, now we're in this area where we're actually attempting to foster a free market. And so we've got a couple of key ingredients. Whenever you talk free market, you have to have supply and you got to have demand. Right now, we're struggling with the fact that most of our doctors are hiding for cover under a hospital-based system because they can't handle the overhead of those 159 organizations between a doctor and a patient right now. So they're all hiding. My wife's a pediatrician, and she's very familiar with this as well. They're hiding under the blanket of a hospital because they can afford to pay all these administrators and take care of all the paperwork, all the issues associated with accounts receivable and CPT coding. They handle it, so doctors hide under there. We're trying to convince doctors it's safe to come out in the water now. The passage of this bill was one of the first steps towards doing that. The next step we're going to need to do is start priming the pump on demand. And one way of doing that is by putting our state employees into direct primary care health agreements, setting that up for local units of government and putting them into these arrangements and agreements, and then making sure that other employers know that it's an option available for them to lower their health care costs. Do you have the support to take those additional steps, you think? Yeah, we're actually doing this right now. It's a little bit of chicken and the egg. You gotta get demand and supply working in concert here. We're going to have some announcements in Southeast Michigan area soon that's going to talk about some large provider networks for direct primary care that are going to be established here soon. And on the flip side, they're engaging with employers in the community to go off and make sure that they've got the demand. At the state level, we're going to be trying to work that and help promote that concept as well. So it's a little bit of now we're in the marketing stage, if you will, where we're trying to convince providers it's safe to come out in the water and convince employers that this is a real good opportunity to provide lower-cost health care plans that actually provide better care. Because they're at their root, they're focused on this preventive care that's good for everybody.
You shared this with some of the other legislators at the conference from around the country. Do you see other states possibly going the same direction?
Yeah, absolutely. As a matter of fact, I have news that Idaho, Montana, Oklahoma, Florida have already introduced legislation similar to this. I know in Utah they were already ahead of the curve and implementing something similar to that before Michigan even got engaged. They're actually implementing this type of solution out in the state of Washington in a pretty aggressive manner. I know that Comcast and Expedia, I understand, have been using a direct primary care-based health plan for their employees in the private sector. And then when you extend this into the public sector and you start looking at government-provided health care, Medicaid is one of the best opportunities to deploy a direct primary care services model. They've done this in the state of Washington, and the cost savings that they get under Medicaid are close to 50% of the cost savings, and they still get all the benefits around reduction in hospitalization on the order of 50% as well. So in other words, the folks in the low-income bracket, the ones who need this care the most, they're getting better care, and we're doing it for less burden on the taxpayer.
Yeah, it's good news. It's great news because it's not, again, we're not just talking about the possibility here. You guys are actually doing it, and now other states are looking at doing it as well. What can citizens do to help push this the right direction?
Well, it starts with every one of your doctor visits. Let doctors know that this is a model that's available. Start promoting and introducing the term direct primary care services. But from a legislative perspective, I've actually outlined a strategy and that we conveyed out at the conference, at the Pro-Family Legislator Conference. And I've actually put up a website at morningmichigan.com that can walk people through kind of FAQs or frequently asked questions on a federal, state, and judicial strategy. It provides some information around the direct primary care service model, including links into studies that reflect the numbers that I was just talking about. So we can arm legislators to go off and promote this, and also kind of get people excited in the business community to say, hey, this is something that I really want to go off and pursue.
Good stuff, man. Good stuff. All right, everybody's got some action steps they can take in their community. Also, a lot of legislators listen to our program. Frankly, I think pastors ought to be speaking about this as well. It affects all of us. So great stuff. I think, Senator, you might have started something here, man. Already several states following suit on this, and could be the silver, not necessarily a silver bullet, but awfully close. Like you said, it's a loophole, a free market loophole, right there, smack dab in the middle of this abomination of a bill that was adopted by Congress. So we appreciate your hard work in digging into it, finding it, now implementing it.
Yeah, I appreciate it. It's all kind of the centerpiece of what I like to call an exploit then repeal strategy. Take advantage of this free market loophole, and by the time you fully expanded the footprint so that people have access to their primary care doctors, and it's already authorized in the Affordable Care Act, when you go off and pull the plug on those 159 organizations that are trying to control our life on the back end back up in D.C., people won't even notice they're gone.
Won't even affect them because we will have already done the end run, not the end run, straight up the middle, right to the doctor, patient and doctor. Once again, having a relationship. That's the way it ought to be. Hey, brother, appreciate it, man. Keep up the great work.
I appreciate the opportunity to get the word out, and you keep up the good work, too. You guys are great at WallBuilders, and say hi to David for me.
We'll do it. That's Senator Pat Colbeck. We're going to take a quick break. We'll be right back with David Barton. Have you noticed the vacuum of leadership in America? We're looking around for leaders of principle to step up, and too often, no one is there. God is raising up a generation of young leaders with a passion for impacting the world around them. They're crying out for the mentorship and leadership training they need. Patriot Academy was created to meet that need. Patriot Academy graduates now serve in state capitals around America, in the halls of Congress, in business, in the film industry, in the pulpit, and every area of the culture. They're leading effectively and impacting the world around them. Patriot Academy is now expanding across the nation, and now's your chance to experience this life-changing week that trains champions to change the world. Visit patriotacademy.com for dates and locations. Our core program is still for young leaders 16 to 25 years old, but we also now have a citizen track for adults. So visit the website today to learn more. Help us fill the void of leadership in America. Join us in training champions to change the world at patriotacademy.com.
Let the torch of freedom burn.
Welcome back to WallBuilders Live. Thanks for staying with us on this Good News Friday. And special thanks to Senator Pat Colbeck up in Michigan for taking time to join us today, and taking time, David, to read the whole Obamacare bill. How many guys in the country can say that?
Well, there's a few other things that struck me as I was just going through. Did you hear what section he said the loophole was in?
It's like 10,000 something. I was, if you got that many sections.
10,104 sections in the stinking bill, and that's where he found the solution. And now, we don't even need 10,000 separate laws, but we got 10,000 sections in this one bill. You got to be kidding. And he actually read through all of those sections. I can understand why nobody else read this bill, but my goodness.
I should have asked him, how many times did you fall asleep?
Oh, yeah.
While reading this
how
bill?
many months did it take you to read this bill? And what's really kind of funny and listen to it is that the bill established 157 layers of bureaucracy between the doctor and the patient. 157 new bureaucracy layers. And, I am firmly convinced that having 157 layers between doctor and patient will definitely improve our health care. I mean, no question to me that's going to be cheaper. It's going to make it more affordable. I don't know what the critics are upset about over Obamacare, because this clearly, having 157 bureaucracies between the doctor and the patient.
Obviously going to speed up how quick you can get to your doctor.
You bet.
Yeah.
I mean, I understand why the Democrats push this. It is such a good solution. Sorry, I got caught up there. 157 bureaucracies not only 10,000 sections, but 157 bureaucracies. And one doctor needs 5 to 7 patient paper pushers. One doctor needs 5 to 7 patient pushers under Obamacare, but because of the loophole, if you use that loophole, 3 doctors need 1 paper pusher? Now, tell me which is the cheaper way to go.
Right. What's going to be better for the patient?
Yeah, I mean, this is a no-brainer, and I love the fact that it was just almost humorous. The loophole actually allows you to have traditional medicine. I mean, the loophole says that if you want to, you can have old-school traditional medicine where the doctor and the patient get together and make decisions for the patient. No 157 bureaucracies needed to make decisions for the patient. Doctor and patient can actually do that. And that's the loophole, is to keep medicine where the doctor and patient can talk. I mean, this. I'm glad he found the loophole. I'm glad they got it passed. I'm glad they're moving that direction. I mean, what do you say? In Washington State, it's already reduced 50% the cost of Medicaid in the state of Washington. I mean, this is good stuff. But wow, who would have imagined that you would have had a loophole tucked in over 10,000 sections late in the bill that would essentially dismantle the whole bill?
And it would be as simple as just going back to doing it the way we used to do it.
Exactly. Going back to doing it the way, and having less paperwork and less bureaucracy and more contact. I mean, that's good news. We'll see what the Supreme Court does. Maybe in a year this is not needed at all by anybody. But in the meantime, this is a great thing to get done in your states. Reduce the cost, improve the health care.
Excellent news for us this Friday. Thanks for joining us today on this Good News Friday. You've been listening to WallBuilders Live.
We stand undivided.